Hello, welcome to ANA community. So far, we have discussed the history, case history part. Initially, we have discussed chief complaints. This is followed by analysis, detailed description of each of these complaints, which will be dealt in history of present illness, previous history, family treatment history, family history, personal history. In this particular video, we are going to discuss menstrual and obstetric history. When we speak about the menstrual and obstetric history, they are actually nothing but the part of the personal history of the women. Menstrual history is actually related to age of menarche and age of menopause, if applicable. Whereas obstetric history, that is related to delivery related inquiries. Why we need to know about these informations? The diagnosis of precocious puberty that can be made if the girl attains menarche at a very early age group. That is around if the normally adolescent girls get menstruated at the age of 12 years or so. If the girl starts menstruating, getting menarche at the age of 10 years or so, then we are going to say that that is a precocious puberty is attained. Whereas the attaining the menarche at a very late teens or very late age, that may indicate either endocrine disturbances or genetic disturbances. Wherein obstetric history specifically helpful in knowing about the details of the delivery, whether it is vaginal delivery or assisted delivery such as cesarean section or forceps delivery, etc. If it is the if there is the woman is multipara, then there may be a possibility of laxity of abdomen. And if there is the cesarean section is being done, if not proper precautions are being taken, there may be a possibility of a development of incisional hernia or umbilical hernia. So these are these informations that are helpful in getting the overall health status of the woman. When you think about menstrual history, that is actually we are going to inquire about the Raja Pravritti, whether it is regular or irregular. What do you mean by regular or irregular? In the sense, the lady is getting the on every specified day, if the lady gets menstruation, then we are going to say it is regular menstruation. If the lady is not getting the regular menstruation, that may indicate irregularity. That actually helps in determining the ovulatory cycle or anovulatory cycle. Ovulatory cycle in the sense there will be the ovulation that will be taking place during that particular menstrual cycle, whereas anovulation refers to there will not be ovulation during that particular menstrual period. Usually, an ovulatory cycle will be associated with weight gain, which is indicative of the kapha dosha increase in the body. Whereas ovulatory or excessive menstrual flow, wherein the predictability of the menstruation that is possible, which may result in increase of either pitta or vata dosha. When you say about the days of the flow, usually that may range from 2 to 7 days. Usually, second day that lady may have excessive menstruation that will be gradually getting decreased as the day passes. So, suppose if there is spotting is being present, then that may indicate vata dosha increase. Increase in flow with clots may suggest pitta dosha increase. White colored discharge that may indicate kapha dosha increase. As far as duration of cycle is concerned, on an average 22 to 35 days are considered to be the on an average duration of menstrual cycle. That is the range of menstrual cycle. Too frequent or too delayed in the menstrual cycle. That is, if the lady is getting the menstruation at the every 21st day, definitely that may indicate vata dosha increase. Too delay, that may indicate again vata dosha increase. But the gunas of the vata that may get vary. And consistency of the flow will be helpful in determining the dosha dominance. Whereas nature of flow, increase in number of pads usage or that is indicative of a heavy bleeding. Whereas presence of clots that may again indicate heavy bleeding. Foul smell and that is indicative of a infection, vaginal infection or cervical infection or uterine infection, etc. Any other complaints, for example, pain in the low back or lower abdomen, can be attributable to the uterine cramps or pain during the ovulation time. That is what we can say mid-cycle pain. That is termed as metallic skimmers. That may be present. That has to be acquired. Dysuria, that is painful micturition, may indicate either urinary tract infection as such, whereas itching around the vulval region that may again indicate the either the fungal infection or the some other kinds of the infections as such. Whereas white discharge, normally this may occur a week before menstruation. If it is having the thick whitish discharge with foul smell, etc., that may indicate vaginal infections as such. So, like that, the history should be in this way regarding the Rajab Pravritti, days of the flow, duration of cycle, then nature of flow, clots or odor, and any other presenting complaints. So, this will be helping us to know about the overall health status of the reproductive system of the female. As far as obstetric history is concerned, that has to be written in terms of G, P, L, A, and D. So, wherein G refers to gravida, that means attaining the pregnancy itself, whereas P refers to parity, that means the fetus attaining the state of viability. If, for example, 4 months later, the child may have the state of viability. Before that, if the miscarriage happens, then we cannot say it is parity. It is categorized under abortion category. L refers to living child and D refers to the death of the child after the live birth. So here we are going to note about the details of each and every delivery. The first delivery, second delivery, third delivery, like that. If there is any mode of delivery, is it vaginal or assisted delivery. Whether is it due to cesarean section or not, whether is it due to forceps delivery or not, that has to be inquired. And after that, the postpartum complications. If there is any postpartum complication, such as the postpartum hemorrhage, etc., if it is being present, or any kind of the infections related to the uh, female reproductive system, that has to be written in this particular third column itself. So first delivery, second, third, etc. In that way, that has to be written there. The take-home message from today's discussion: menstrual and obstetric history are part of the personal history of a woman of a childbearing age group. Menstrual history gives us the details of events of menstrual cycle, whereas obstetric history gives us the details of events occurred during the delivery of the child or children. In both the cases, there may be a possibility of the initiation of apanavata, which may be getting afflicted due to irregular personal hygiene. Dear ANA members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. If what is the one topic that you'd like to hear in the coming videos, mention in the comment box below. If you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.